Welcome to Medtalks, your go-to source for health information and medical insights. I'm your host, Juvenava, and we are bringing you the latest in healthcare. Whether you're looking to understand the basics of wellness, gain practical tips for everyday health, or learn about community resources available to help you live a healthier and happier life, Medtalks has you covered. Join us on this journey to better health, and remember, a healthier you starts with a single conversation. Stay informed, stay healthy with Medtalks, where every talk is a step towards a better you.
GraceMed Health Clinic is your home for complete compassionate care. From medical visits to vision screenings, dental care, behavioral health support, and a fully equipped pharmacy, we're here to meet all your health needs. Our dedicated team of providers and staff work together to make every visit welcoming and stress-free. Because at GraceMed, you're not just a patient, you're part of our family. Call 316-866-2000 to schedule your appointment. GraceMed Health Clinic, compassionate care for all.
Welcome, guys, to another episode of Medtalks. I'm Juvenava, Director of Outreach and Communications here at GraceMed Health Clinic. I am with Keith Line from the Workforce Alliance of South Central Kansas. Hi, Keith.
Hey.
How are you?
I'm doing great. Thank you for having me today.
Well, thank you for coming over
You
and
bet.
seeing us today. Keith, talk to me a little bit about the Workforce Alliance and also about Retain Works.
Sure. Workforce Alliance, we're the local workforce development board here in the Wichita area. We operate the Wichita Workforce Center at 21st and Amidon, and that is a place set up for anybody looking for a job, employment. We have multiple resources there. We have partnerships with the state of Kansas. Nice. Anybody from looking for, if you've been laid off, if you just need a better job in general, we do a lot of employment, pre-employment workshops, posting jobs. We host a lot of job fairs. So, and again, like I said, not only with the state of Kansas, but we work with other local job training programs here and employment services.
Awesome. I actually do know about the Workforce Alliance.
A little bit?
Yes, a little bit. First of all, I've been there before. I was an employee there. But also, our navigators here at GraceMed, sometimes we have to refer people there who are unemployed and need that. But what I didn't know about was Retain Works. Can you talk to me about that?
Sure. And one of the things that we're really designed to do, because we're publicly funded, and our goal as an organization is to eliminate barriers that people have for employment. And so again, that lack of skills is a barrier a lot of times. So we can help people with training. Sometimes just lack of knowledge or awareness about who's hiring and what are the best jobs out there. So we can certainly do that. And so we're always looking for unique opportunities to help promote employment within our community. And so a few years ago, the federal government put out a grant, and it looked to see, was looking at individuals who'd been injured in the job or had an illness and were not able to return to work at that previous job. Well, could we figure out a way, if that was a barrier to employment, how could we train them? How could we get them into a different job? So Kansas is one of 8 states that got a planning grant. And so we started an initiative a few years ago with in El Dorado with Susan B. Allen Hospital. As a state, we then applied for the second phase. We did well enough to get the second phase, and that's where Retain Works came in. So for the last few years, we've created a statewide network, and really the idea is to connecting the healthcare system to the workforce system. And again, too much you have the health navigators. So those individuals who are injured at work and coming in and getting healthcare services, those nurses and doctors and physical therapists can now help them connect to employment to say, okay, maybe you hurt your back and you can't stand all the time, but you could sit. Maybe you could transition to a truck driver. And I say that because we've helped people get a CDL, that certified driving license, so they can change careers. So that's what Retain Works has really been all about, is how do you connect these two systems where people are interacting and try to get them to a better outcome, as opposed to even having to take workman's comp or not being able just to get out and work like you want to.
Yeah. What kind of barriers have you seen that have prevented them from returning to work?
A lot of times, again, it is more that physical barrier, and we've helped with firefighters, and so they've gone from, and we've worked with their employers to find some accommodations, maybe a different job description. So can you shift somebody to an administrative role? And so do they need to learn a computer system, a computer network? I mean, so we've helped do that, and ideally, what we hope to do is work with as much as possible with what that individual wants to do. If they want to stay with their current employer and job and that employer wants to keep them, well, how do we figure out a way to make that happen? Again, skill them up to a different position or make some accommodations there at work.
Great. Nice. When we talk about like barriers and the opportunities that your team has to help them get back to work, what does that look like besides providing like the services? Like what services do they actually provide to get them back into employment?
Well, again, there's going to be that assessment. It's really going to find out, what is it that you're looking for. We can provide labor market data. We know who's hiring. Again, so a lot of it's just that individual, because Wichita's the air capital. And so, just because, Spirit or, Boeing now or Textron Aviation is hiring doesn't mean you want a job or have a skill set there. But maybe there's a job opening in that company that fits your skill set. And so we could help you map out what the labor market looks like and identify what that career pathway is. And then I go back to the barriers. A lot of times if you've had one job for a long time, and even if you're quite skilled, you may lack some technical skills. So again, whether it's digital literacy, what do you need to learn new about? Maybe you need to get certified in Excel, so you can do spreadsheets and start doing administrative tasks. So those are the kinds of things that we can help those job seekers through the Retain grant and then at the Wichita Workforce Center for Services in general.
Can you talk to me about a success story that y'all have had recently of people who've used RetainWorks?
Yeah, I'm probably not the most well-versed on that one, on the individual success stories. Yeah. But I know what we have managed to do is, and again, I mentioned the commercial truck driving. We had an individual who worked in retail for a very long time. And again, it's kind of weird you think of back injury, but standing was what the problem was. It was standing for a long time, in that retail environment. Yeah. But they could figure out, and they had worked in this industry for a long time, so they had been there for 15, 20 years, so they were well up in the pay scale. So that's kind of the problem a lot of times. Starting new, you got to go down to the bottom of the pay scale. But because this person said, and the health assessment was, you can sit, you really can't stand. That's where your injury is. That's the long-term ramifications of your injury. We're able to get this person a commercial driver's license. And there's tremendous job openings right now in the logistics and that area. So we were definitely able to help that person. And that was the deal, is that they were able to find a job in a different industry at a very similar pay scale. They did not have to take a big job cut to get back in the workforce. So that's one of the things we try to do with RetainWorks and our programs overall, is how do we, if a person has to change industries, try to get them where they are maybe not totally whole for where they previously were, but very close and on the way where they can make that kind of money again. So those are the things that I think RetainWorks can really help, or just our services in general can help that job seeker with that really focused job search. Right.
And that's great to know, because I know looking for employment can be very difficult and very challenging, just because they might have their own personal barriers that they have to overcome, and just trying to get back into the workforce can be very difficult. So talk to me about, how does someone get into services or to get services? How does that start?
Sure. And it's a lot different from when you were working with us, Juven, because we just have so many different, the technology's increased so much, and there's so many different avenues. And again, I think part of the challenge is there's so much out there for that job seeker. And so again, we can help you on that focused job search. We can help you narrow down and look at your skill set. And so I think that the first step, you can find us either physically walk into the Workforce Center at 21st and Amidon, or you can go online to kansasworks.com workforcekansas.com. That's one website. Or workforcekansas.com. So multiple websites, easy to find, no wrong door approach, so you can get into the system. But registering at Kansas Works, that's the state job board, that gets you in the system. That's the first step. And that's the way to access services from us. And again, we can provide, and that's another thing that's changed since you worked for us, we do a lot of virtual services. So you physically don't necessarily have to come into the Workforce Center. We can do a Zoom meeting, a team meeting. Most of our pre-employment workshops, we record those, and we can do live webinars as well. Or you can physically come into the 21st and Amidon Center. So that's really the first step in accessing services. And I think that what we've also seen is that individuals, and again, I want to really relate this to GraceMed, but people need jobs where they can get health care benefits. We can help you find jobs with employers who offer those. I think child care is a really big issue right now. We're working with businesses who are providing child care benefits to their workers. So again, how do we try to match, again, those barriers to employment? We want to try to remediate those barriers so those individuals can get into those great jobs.
We've noticed this with a lot of organizations that provide any kind of support or supportive services, that there usually is a time limit. Is there a time limit for someone who's interested in this?
Not necessarily. I mean, the time limit is more based on employment. So, for example, if you're enrolled in one of our programs and you're going to a training program and you need child care assistance, that child care assistance persists as long as you're in that training program. You know, we get you up to employment. The idea is once you're employed, then that's a service you won't need that financial assistance anymore. But our services, there's not a built-in time limit other than that employment time frame and the time you would be eligible for that service.
And once they get the employment, is there any kind of services that offer them to help them to stay employed?
Oh yeah, we do. We work with those businesses on the retention strategies. Again, we can still provide transportation a lot of times for that first 60 to 90 days after employment. Everything from a bus pass to maybe even a gas card or something like that, just to pay for gas and those type of things.
We've noticed that our listeners are also people who run nonprofits or are small business owners. Is there an opportunity for them to connect with you, to partner up with you? And if so, how does that look like?
Oh, I'm so glad you asked that question because, again, we look at our system as dual customers, both that job seeker but also that employer. And we really do want to find help with that business in terms of job postings, job fairs. We can screen applications, especially those small businesses to not-for-profit organizations that, you know, your HR director might wear 2 or 3 different hats. You know, he or she doesn't have time to maybe go through all the job applications or focus on the job postings. So again, contact us through the Wichita Workforce Center. There's a whole segment on our website about employer services, and that's the best way to get in touch with our business services reps.
That's awesome. Keith, I've been aware of obviously the workforce for such a long time, and I've seen it grow throughout the years. What does the future look like?
Wow, that's a good question because it changes so rapidly. I think really it's all about technology. I think there is kind of a collective, kind of a technical term, freak out right now about AI and the impact AI is going to have on jobs. You know, I've been around long enough. I've seen this kind of cycle. I mean, ever from when the internet was first growing up, and then robots, and then autonomous vehicles. I think the key for the future, as far as I'm concerned, I think we all need to understand the digital world as much as possible. So just because you don't like AI or you think it's silly, you need to obviously figure out how it operates, how it works. And I think as much as possible, that's the best way, because I do think there will be jobs created. There's going to be jobs we're going to lose, but jobs are going to be created all the time. But the key is going to be really understanding the technology as much as possible and having that self-advocacy within the system. I think people really, and that's where you would get, I think the better you understand that, the more you can self-advocate for yourself and try to navigate through the kind of crazy economy.
Yeah. We have this new generation coming in who are seeking jobs, and especially we want them to stay in Wichita, right? And so what opportunities do you see them, or do you see that are available in Wichita that perhaps young people would want to be a part of?
Well, Again, I think that the healthcare field is an area that I really, if you have any interest in, it's not just that direct patient care. There's the business of healthcare.
Definitely.
You know, whether it is from anything from insurance, you know, and management, the administration of a business office, but there's going to be ongoing growth in the healthcare industry. And what we have going on in Wichita with the new biomed campus downtown, that's going to be a huge growth area. People like me are getting older. We need those services. There's going to be wellness. I mean, there's going to be other things that we haven't done in the healthcare system in the past. So that's definitely, I would also, and I'm really pleased with what Wichita State University has done on the innovation campus. I mentioned technology. I think our community is really well entrenched, and not so much that you have to go get a 4-year degree, but there are programs that can keep you relevant in the workforce with the kind of economy we have. And then the last thing I would say in terms of really thinking about it is the more earn and learn models we're starting to see emerge. You know, so if you're I got a 19-year-old nephew right now, and he's got he loves music and he loves auto repair, you know, and he likes to work on cars. Well, he's talking about a registered apprenticeship so he can become a mechanic, but he can earn and learn that, and that at the same time he also wants to pursue musical interest. So he's trying to find that balance. But I think that earn and learn model, where you can get your academic credentials, you can start earning money, that really does help propel a young person these days into great career opportunities.
Yeah, I think that's incredible. I think that's great advice. So going back to people who are needing services, just to remind them, if they're looking for services, where do they need to go?
Wichita Workforce Center at 21st and Amidon. KansasWorks.com is easy website. It'll be have a lot of information. And then WorkforceKansas.com is our website here locally. So.
Awesome. Is there anything that perhaps I didn't ask that you would like to?
Well, not necessarily, but I do want to say, I want to give you this. This is our Retain Works mug.
Nice.
And so it does have our website. So again, if you are ever injured or you're looking to try to find some services to get back in the workforce, retainworks.org is a more general website.
You know, I love me a good mug too.
And then again, this is another practical gift too. Okay. So you got a notebook. So again, us with more Retain Works stuff. But we're really thrilled, and I just do want to kind of end our conversation about Retain Works. It is a little unfortunate we were not able to secure ongoing funding, but the idea of the grant was really to help build some relationships and connections between systems, and I do think that the outcomes of the grant will be able to persist beyond the funding, and just in terms of the ability for individuals to navigate between those two systems, you know, between the healthcare system and wanting to get back to work and how to make those connections. So it's been a great project, and I'm really proud of all the staff, and I really want to thank the State Department of Commerce. They did a great job in leading it for us.
That's awesome. Before we leave, I like to ask this question to everyone. Well, first of all, 2 questions. If there's anyone who wants to support this, or we also have legislation who listen to this, what kind of support do you need in order for this to continue?
Well, I think it's really for policymakers, really understanding the impact that these programs have. I mean, I think a lot of times when we're at full employment, people don't think you need to invest in job training, and you really do. You need to keep up with the economy and the changes in the economy, and in particular for our young people. You know, you kind of mentioned young people coming on. I think we're still seeing the impact of some of the shutdowns we had over COVID, and young people navigating their career opportunities. And so I really think focusing attention and resources on that 19 to 24-year-olds. We need to get these folks in the workforce in a career pathways. And so I think that's the most important thing for policymakers to understand. We need to make investments, and these investments will pay off.
Yeah. And my last question, Keith, is obviously working in this field, there has to be some kind of passion to it. So where does your passion come from?
You know, I guess it's growing up, you know, both my parents were, I don't want to say community activists, but they really focused on making the environment they lived in a better place. And so I grew up with that in me. And this is just a way to do it. I mean, you mentioned the politicians. Everybody running for office talks about jobs.
Right.
You know, when a lot of times you read our obituaries, it talks about what your career, your job was. Yeah. And so that's so important for people. And knowing that I'm in the middle and I can make a little bit of a difference for somebody, and people I may never know, that's what drives me. That's what drives me.
Thank you so much, Keith.
Oh, you bet.
I really appreciate it.
Oh, thank you, Juven.
Well, thank you guys for listening to another episode of Med Talks, and we will catch you on our next one. Thanks, guys.